Go.
Alright, so what seems to be the problem today, ma'am?
I'm having difficulty breathing and I've got this cough that's not going away, so I think I might be having an asthma attack.
Okay, so I can see you're having difficulty breathing. Okay, so what I'm going to do is I'm going to place an oxygen mask over your face just to help assist with your breathing. Is that going to be okay?
Yes, that's fine.
Okay, so describe how you're feeling at the moment.
Oh, it's just shortness of breath.
Yep.
I'm just coughing and I'm quite tight. My chest is a bit tight.
Bit tight? Okay. So how quickly did that come about when you started to become short of breath? Pretty quickly? Okay. So what were you doing at the time that you became short of breath?
I was mowing the lawn and just got shortness of breath.
Shortness of breath?
Yeah.
Okay. So do you have any pain anywhere at all? Not at all? Okay. Do you normally have shortness of breath when you're mowing the lawn?
Yeah, but only like it lasts for a minute or two.
A minute or two? Not this long? Okay. Do you become short of breath during the night? Is there any time during the night you become short of breath?
Not really. Sometimes just before I go to bed, just before you lie down.
Yep.
But yeah, just take a couple of that and it goes away.
Okay, so you're able to lie down,
I'm
okay?
able to lie down, okay, yeah.
Yep, alright. Is there anything that makes your breathing any worse or any better at all?
No, usually just sit down when I feel I can't breathe.
Yep. So at night time, is it any worse or is it any better?
It's usually worse at night time because throughout the day, do your work and stuff, just before you rest,
Okay, so have you adjusted your lifestyle at all due to your breathing? Like, do you take an elevator now instead of using the stairs or that sort of stuff?
I have to.
You have to? Okay.
And I can't do excessive exercise. I can do light, but I can't.
Can't do excessive sort of stuff? So does your asthma come about when you do lots of exercise? Yeah. Okay. Do you have any vomiting or nausea with your asthma at all? No. Do you cough up blood? Have you ever coughed up blood? No. Have you had any excessive sweating at all?
No, not really. Only if I have
severe attack.
That's when it happens, but at the moment, no, I haven't had any.
Yeah. Do you feel anxious at all right now?
A little bit, yeah.
A little bit? Okay. So when was the last asthma attack you had?
Last week.
Last week? Okay. So when was the last time you saw your GP?
About a month ago or so.
About a month ago?
Yeah.
So have you been ill recently at all?
Not recently.
Not recently?
No.
Do you get the cold or the flu frequently at all?
Oh, not really. I wouldn't say frequently, no.
Okay,
not
so
as frequent as everyone else, no.
Do you get it when was the last time you had the cold or flu?
A few months ago.
A few months ago, so a fair while ago. Yeah. Okay. Do you smoke at all?
No.
No.
I can't.
You can't.
No.
Okay. Have you had any weight loss recently?
Not really. Not that I know of.
No. Okay. Do you have sore muscles? Do your muscles get sore easily when you're doing physical exercise?
No, not really. Only when I'm getting an attack, my body becomes a little bit sore.
Okay. Have you noticed that your lips are becoming blue at all when you have...
Yeah, severe attack.
Severe attacks?
Yeah, which I had about 3 months ago, but at the moment today, for the last few months, I haven't had that at all, so...
Okay. Have you ever been hospitalised before?
Yes,
You have? When was the last time you've been hospitalised?
3 months ago when I had the severe.
The severe one?
Yeah.
Okay. Were you in intensive care before?
No.
You weren't? Okay. Have you been unconscious when you had your severe asthma attack?
I wasn't unconscious.
You weren't? Okay. Are you currently taking any sort of medication to help assist with your asthma?
Just a puffer.
Just your puffer? Okay. Have you had any bad reactions to your medication? No. What about any sort of allergies or medications that you can't take?
I'm not allergic to any medications, but I'm allergic to dust and animals.
Dust and animals?
Anyway.
Okay. Do you have any family members that possibly have asthma or a past family history at all?
Yes, my
Is there anything that may have caused you to be upset lately? Are you feeling? Is that okay?
Not really.
No. So, what about with work and
That's
family?
stressful, but
It is?
no, got really nothing to do with that asthma thing.
Okay. So, when was your last meal, if I could ask you that?
About half an hour ago, had a sandwich.
Had a sandwich?
Yeah.
Was there anything on that sandwich that may have caused this?
Not
at all?
something I've never had before.
No? Okay. So when was the last time you had some sort of fluids?
When I was mowing the lawn.
Mowing the lawn?
Yeah, I had water bottle with me.
Yep, okay. So when was the last time you went to the toilet?
This morning?
This morning?
Yeah.
Okay. Have you noticed that there's any sort of swelling around your legs or your feet at all?
No.
No? Okay. So, based on this information, ma'am,
Yeah.
I suspect that you are having a mild asthma attack.
Yeah.
Okay, that's just what based on the information that you've given. So what I'm now going to do is I'm going to do some general observations just to
Yeah.
make sure that your entire body's okay and it's not just what you suspect is the asthma.
Yep.
Okay?
So, you're going to take me to the hospital and we'll have
Yeah,
to stay
well-
overnight or...
Yeah, well, I'll take you to hospital just for a general observation, just to
Yeah.
make sure that your condition doesn't deteriorate,
Yeah.
and that if anything does go wrong, that we'll be able to treat it effectively.
Okay, no
Okay.
worries.
So how I came to this diagnosis is the patient presented a cough, she had a tight chest, and some shortness of breath, but was still able to speak in full sentences in between her breaths. And this is associated with a mild asthma attack. Not only did the patient have these symptoms, but the patient told me that this happens around the same time each year, and she has a past history of having asthma attacks. Also, the patient has a family history of having asthma, being her mother, and she is also allergic to dust and some animals. Also, the patient told me that when she undertakes physical activity, her asthma is triggered easily. So the difference between chronic obstructive pulmonary disease, or COPD, compared to asthma is that COPD is the co-occurrence of chronic bronchitis and emphysema, a pair of common known diseases of the lungs in which the airways become narrowed. COPD is defined by its characteristically low airflow on lung function tests. In contrast to asthma, this limitation is poorly reversible and usually gets progressively worse over time. A classic sign of pulmonary edema is the production of pink frothy sputum, which the patient did not show. The clinical assessments that I would do to confirm this diagnosis would be a respiratory assessment plus a pulse, a blood pressure, just to check her vital signs, just to make sure everything's okay with the patient, and just to confirm those vital signs, just to do an ECG as well.